With that, the Ontario Medical Association, District 9.
Thank you. I'm Dr. Stephen Cooper, and I'm joined today by my colleague, Dr. Sarah Newberry from Marathon. Thank you for the opportunity to present to this committee as the government develops its 2022 budget. And the message from Ontario doctors is simple. Healthcare spending must be prioritized, especially in Northern Ontario, where the situation is most dire. I've been a rural doctor on Manitoulin Island since 1992. And I'm speaking today in my role as the OMA Chair of District 9, better known as Northeast Ontario. That's Wawa to Temiskaming Shores, Moosonee to Parry Sound. It's a large area that includes downtown Sudbury and remote Manitouwadge, mining and resort communities, remote and downtown Indigenous communities, a large Francophone community, as well as Italian and French communities. A health science center that is striving to be world-class, and a health centers like the one that I work in that provide general cradle-to-grave care delivered by all-purpose nurses and physicians. I don't need to tell you that access to healthcare in the Northeast is problematic. Just over 89% of people in the Northeast report having a primary care provider, well below the Ontario average of 94%. The region also has the second highest proportion of people over 65 and the second highest proportion of those over 75. We're old. The life expectancy in the North is 2.5 to 2.9 years lower than the Ontario average. Today, Northern Ontario is short of 325 family doctors, internists, psychiatrists, pediatricians, anesthesiologists, and other subspecialists. Many of my patients have to travel to Barrie or Toronto for specialist care. Manitouwadge has been without a doctor for a number of months. Matheson, Iroquois Falls, Chapleau, and Cochrane have less than half the number of doctors required. Timmins and North Bay have difficulty filling their ED roster, and the shortage of GP anesthesia and general surgeons risk surgical and OBS programs in smaller cities. COVID-19 has exacerbated the wait times for patient care. It's not just a number. My patients that are unable to return to work from a lack of access to orthopedic surgery, mental health, and waiting to see specialists for difficult to diagnose and manage problems. The North was disproportionately affected by mental health and addiction challenges before the pandemic, and the situation has worsened significantly. I can say from my shifts in the emergency department, the challenges in mental health and addiction are the most common problem I see. Let me touch on virtual care. Like you, the pandemic has pushed us to embracing work virtually. To many patients and physicians, this has been a wonderful addition to the healthcare. For the North, with its large geography, and virtual care has always been critical to providing access to medical care, mental health, and addiction medicine. It's time to accept virtual care as standard and make the temporary OHIP codes permanent. Great as it is, virtual care must never be considered as a replacement for clinical shortages in the Northern Ontario. It does not and should never replace in-person care. So lots of gaps in healthcare, and it needs to be addressed. Where to start? Last year, the OMA undertook the largest stakeholder and public consultation in its 140-year history to understand where those gaps are and how to fix them. The 8th-month consultation began in Northern Ontario and included roundtables of Northern Ontario's leaders representing a broad range of sectors. The result is Prescription for Ontario, doctor's 5-point plan for better healthcare, launched in Sudbury in October. It's a roadmap of 75 recommendations to get healthcare on the road to recovery, but also contains 12 specific recommendations to improve delivery of care in Northern Ontario. It comes down to 5 priorities. Reduce wait times and backlog of services. Expand mental health and addiction communities programs in the community. Improve and expand home care and community care. Strengthen public health and pandemic preparedness. And finally, give every patient a team of healthcare providers and link them digitally. And for the shortage of physicians and healthcare providers in the North, the OMA recommends the following. Commit that all Ontarians should have equitable access to care in their own communities. The incentives and supports for doctors and healthcare professionals to practice in Northern Ontario should be reviewed and updated. It's currently not. A greater focus on education, training, and opportunities to optimize collaborative care in remote communities. Funding opportunities for specialist and subspecialist trainees to do electives and core rotations in the North, and ensure that medical students and residents have the skills and opportunities they need to be confident to provide care in rural and remote practices. We note and welcome government's recent investment of $10.6 million in Northern Ontario, trained 500 workers in hospital and long-term care and home care providers. It's a good start. But remember, the social determinants of health are non-medical factors that influence health outcomes. This connection has been obvious during the pandemic as the highest rates of COVID-19 continue to be in communities with low incomes that are racialized and with poor housing. That's why the OMA is also calling for a collaborative partnership with Indigenous Services Canada and Health Canada to address issues of safe drinking water, adequacy of healthcare facilities, and resources in Indigenous communities. We must also address the education gaps in Indigenous and communities. Education gaps. As education is directly affected the health. So better education, better health. The types of investments just described are not only critical to the health of Northerners, but also the Northern economy. The pandemic has proved we cannot have a strong and sustained economy without a robust healthcare system. We need to keep small business alive, restaurants full, schools open. The link is more pronounced in Northern Ontario. One of the first questions businesses and professionals ask when they are thinking of moving to the North is, what is the healthcare like there? And are there human doctors available in the community? The strong healthcare system in the North will not only support our important resource and recreation retirement industry, but help attract new businesses, residents, and investments, bringing with it new opportunities for our younger people. Thank you, and I would be pleased to ask any questions.
Well, thank you very much for that presentation. Before we go to the questions and